Be on the lookout for ways that delirium, or serious acute confusion, interacts with other conditions within mentation, such as dementia and depression, and with what matters, medication and mobility. Older adults with dementia are at increased risk of delirium. Educate older adults and those who support them about this risk and ways to prevent delirium. If delirium co-occurs with dementia, as with all cases of altered mental status, assess and treat potential causes of delirium. Also, continue to assess and manage underlying dementia. If an older adult has a sudden change in mental status, consider the likelihood that it may be delirium until that is ruled out. Untreated delirium can be a life-threatening condition. A number of evidence-based interventions may help with certain aspects of mentation, including delirium, dementia, and depression. For example, gently orient older adults to time, place, and situation as appropriate. For some older adults with delirium, especially those with underlying dementia, reorientation may not be productive or helpful. Assess each person individually and evaluate whether reorientation is likely to be helpful or not. Consult other interprofessional team members if you are unsure. When orienting an older person, update the day and date on the whiteboard. Provide an accurate clock with large face visible to older adults. Consider using tools such as an All About Me board or poster that shows what activities an older adult finds calming or makes them feel happy, who is important to them, the names of their pets, family members or friends, and so on. Make current or recent newspapers and periodicals available in older adults' rooms if that is something that they enjoy and are able to engage in reading. Invite family or other caregivers to bring familiar and orienting items from home, such as family pictures or items from favorite activities. Identify environmental and person-centered approaches to orienting older adults as appropriate. Avoid repeated testing about orientation if an older adult appears confused or overwhelmed. Meet the person where they are. For example, do not try to correct an older adult who believes it is a much earlier time or that their parent needs to visit. Use techniques such as distraction or diversion, a walk inside or outside, looking through favorite picture books, or listening to music and dancing. Ensure older adults have their personal adaptive equipment. Personal adaptive equipment includes glasses, hearing aids or other listening devices, dentures, canes, wheelchairs, walkers, or other equipment. Incorporate routine monitoring and documentation that an older adult's personal adaptive equipment is accessible and in good condition. At the start of each shift, check for sensory aids and clean them if needed. Prevent sleep interruptions. Use non-pharmacological interventions to support sleep. These may include earplugs or sleeping masks. Avoid overnight vital sign checks and blood draws unless absolutely necessary. Create and use sleep kits that include items such as a small CD player, CDD with relaxing music, lotion for a back rub or hand massage, non-caffeinated tea, lavender, and sleep hygiene educational cards. For example, discouraging caffeine after 11 o'clock in the morning or promoting physical activity. These can be placed in a box on the unit to use in older adults' rooms as needed. Determine which of the options in the sleep kit may help each individual older adult. That is part of person-centered care and support. When asking an older adult what matters, if the person has delirium, document that in the health record. Ask at a time when delirium symptoms are minimal or absent, and always note the presence of delirium. A person's response to what matters may or may not reflect their true goals and preferences if delirium is present. Many medications can worsen delirium, both individually or in combination. This includes, but is not limited to, high-risk medications. There is no officially approved medication to treat delirium. Maintaining each older adult's safe mobility can help to avoid or mitigate complications of delirium and restore function. The same interventions that prevent delirium may also support safe mobility. Set, monitor, and meet a daily mobility goal with each older adult. If delirium occurs, the top priority is to search for the cause or causes of that condition. Use best practice guidelines for delirium screening, assessment, and treatment, including promoting hydration, safe mobility, helpful sleep practices, and avoiding unnecessary medications. Educate each older adult and those who support them to help prevent delirium and to monitor for any change in condition to detect, as early as possible, if a change in mental status occurs. Ask healthcare team members and other caregivers if an older person seems like themselves, and take immediate action if they have any concerns. Ask caregivers to alert the care team to any changes as soon as they notice them. Delirium prevention is a high priority with older people in every setting. A comprehensive approach to increase awareness about delirium prevention in health systems and communities will reduce the incidence of delirium and promote better overall older adult health over time.